If you suffer from migraines or headaches, join me in this ear stimulation session. Are you a person that tends to clench your jaw, maybe grind your teeth, hold your shoulders up like this without really noticing? I mean, a lot of us do that, don't we? Your ear is going to tell you which points to treat. Grab yourself something like a golf tee, something that's pointy, not sharp. We don't want to break the skin. And remember, you don't have to dig in, you don't have to put a lot of pressure in order to find that point. Tenderness that we feel is actually telling us that there's an active point there. And then that's when we're going to actually massage it for about a minute. Okay, let's get into it. Here are 3 points that you can use for a neck tension based headache or migraine. The first point is a point that relates to the neck, really high up in the neck. And this is an area where there is a lot of tension that a lot of us carry. That's where we put a lot of our stress. This point on your neck is actually in the middle. It's not on the left or the right. So you can do it on either ear or both if you like. Okay. Now what I recommend is you try looking on one ear to see how tender it is on that ear, and then look on the other ear. And whichever ear it's the most tender on, that's the one that you want to actually spend time treating. So I'm going to look on myself first on the right and then on the left, and we'll see which one is the most painful or the most active. C0, meaning it's right at the top of your neck. It's also the beginning of the occiput. Okay, so the back of the head, top of the neck. You can see here where the antihelix ends, and then there's another bump here. So this bump is called the antitragus. Now, where the antihelix ends and the antitragus starts, here is the point that we're looking for. This is C0. Okay, so this is what I'm going to press on to see if it's tender. Now, it's easier if you hold the back of your ear with one hand, and then so you can stabilize and also feel where it is with your finger, so you can guide yourself, and then you can poke around that area. Okay, so I'm feeling a little bit of tenderness here. It's pretty active. So I'm gonna just take a note of that mentally. And then I'm gonna go on the other ear and do the same thing. This is my antihelix, this is my antitragus, and I'm going to find where they meet right here. And I'm going to press with my golf tee in that area to see. Okay, so this point is actually much more tender than the point on the right. So I'm going to spend some time treating this point here. Okay, so again, I'm just moving the golf tee a little bit, and you can either count about 30 seconds, 40 seconds perhaps, or you can go by how it feels. Like I said before, if you take note of how painful it is, and then you try to notice when the pain starts to actually dissipate a little bit, starts to actually go down. Okay? And this could take 20 to 40 seconds. Okay, I'm going to go another 5 seconds or so on this. You can go a little longer if you like. And I'm just moving it a little bit. You don't have to go in circles. You can just move it back and forth a little bit. You don't even have to move it if you don't want to. You can just hold it still. It's up to you. Okay, that's good. Cool. So that was a very tender point for me, and I'm glad because I do have a lot of neck tension. Even though it doesn't give me headaches, I can definitely feel it in my neck. So that loosened me up a little bit. When we have neck tension, a lot of times we also have a lot of tension in our jaw. And you may not realize it, but my guess is many of you probably grind your teeth at night, or at least clench your jaw at night when you're not realizing it. And so just try to notice that as well. And we'll also find the jaw point. Now the jaw point is relatively easy to find below where we just were at the C0 point or the occiput point. And so if you come just straight down in this groove here that comes along in between this part of the helix and the antihelix, there's a groove here. So you come down this groove and it's right below this notch here that we just were in, and you come down a little bit and there you'll find the jaw point. And I'm going to stimulate this. But same with the occiput point, you can try to see on your left how tender it is, and then you can check on your right to see how tender it is. Oh, and mine's definitely tighter on the right. Okay, so I'm going to stimulate it on the right. There, right there. And once you find a good point, you want to make sure you don't slide off that point. And that's why I'm holding my ear, supporting my ear with my left hand, so I can actually be more stable with my right hand. So that's quite tender. So I'm not going to go on time with this point. I'm actually going to go on how it feels. So right now it feels quite sharp to me. And I can actually feel the pain radiating a little bit into the rest of my ear, which is a sign that I found a really good point here. And I'm just paying attention to how that feels. And now it's softening a little bit. I can feel it softening, and I haven't changed my pressure. Okay, so now it's softening a little bit, and I want it to soften a little bit more. Okay, now it's softened. Now it still hurts, but it's not as sharp as it was before. So I feel like that is sufficient for that point. Okay, the third point that we're going to look for is called the stellate point, and it plays a big role in upper body tension, including headaches. And stellate is a ganglia, or a collection of nerves right underneath your first rib, so kind of underneath your collarbone. And this collection of nerves actually has quite an impact on your whole upper body, including your head. So it's often something that's very irritated, and it's often something that very much needs treatment. So we're going to treat that now. You're going to go about halfway up the antihelix, so halfway up this ridge, and then you want to go inside so that you are exactly where the wall of the antihelix meets the floor of the concha. So if your ear was like this, you'd be at a 45-degree angle. Okay? So you're going to try to find that angle, and it's only about halfway up from where we found the occiput. It's about halfway up. And so we're going to be looking right about here. There. And again, you'll find the point through your tenderness, through how painful it is. Okay, there, I found it. Now this is very, very tender, and I don't think that I need to really go and look on the left side because this is very tender. But actually, I might go and look on the left because maybe I want to treat both sides. Because there are actually two, there's one on either side. And sometimes both need to be treated. Unlike the neck. With the neck, it's only one in the middle. And so treating one side is okay. Sometimes with the TMJ, like the jaw point, sometimes with the jaw point or with this stellate point, treating both actually is more effective. Okay, that one's treated now. And again, I wasn't counting the seconds or anything. I was just going on how it feels. And once you get used to doing this, you're going to be able to do the same thing. You're going to be able to really tell when it's finished based on how it feels. Okay? Okay, so again, I'm going to find the C0 point that we did earlier here, and I'm going to go about halfway up the antihelix, just about halfway up or about a finger's width or a little more, okay? And then I'm going to go again where the floor of the deepest part of the ear meets the wall, like this, and right here, okay? That's the angle, okay? So right about there. Okay, and that's also very tender. So I'm glad that I also did the left because it really needed to be treated as well. Okay, and I'm going to just move it around a little bit, keeping the tip where it is, right on that point. And I'm feeling the pain. You can even give it a 1 to 10 scale. Right now, I'd say this pain for me is a 7. And maybe I want it to go down to about a 4 before I let it go. Okay, now it's down to a 6. And sometimes it comes in waves, you know, it goes back up to a 7, but then maybe down to a 5. Okay, and now it's down to a 4. 4 or 5. Okay, that's good. Oof, that was a really tender one. Well, thanks for joining me for this because I needed it too. I hope that it gives you some relief, and join me for another ear stimulation session tomorrow as you take a moment to give back to yourself. You deserve it.